And
Dr.
Poonam
Naval,
ma'am is still here, so yeah.
Yeah, Kaushik or Naval, are you using CO2 at your places?
No, sir, not me.
No, sir.
No. Mhm.
So as far as I know only Poonam ma'am who uses it. So I
Yeah.
don't.
Okay. So probably a जुगाड़ which Dr. Kumar said. Okay, कल से सब लोग अपना लैप्रोस्कोप निकालने वाले हैं, लैप्रो इंसुफलेटर और थोड़ा-थोड़ा थोड़ा-थोड़ा CO2 डालने वाले हैं. I think we can do it on our own first.
Maybe flow meter लगा के we can try, sir. वो जो IV का flow meter आता है ना?
हाँ, IV का flow
That-
meter या ट्यूबिंग पिंच करने का ना.
That's
Amrita
yeah,
ma'am is
that's
back.
also a good.
Naval, Amrita ma'am is back.
Again, for the information of everyone, which course, I mean, has anybody of you done a course abroad? Not in India, abroad. For example, in Turkey or in Istanbul?
What's the problem? That's the only mobile which I have. Yeah, I could hear that too.
Dr. Amrita, you can give a hotspot also.
So, am I visible now and audible?
No, you are
Yes, sir.
audible.
But am I visible and audible now?
Yeah, now we can see you.
Can you see me now?
Yes.
Right, Bhavna ji, we can see what they are doing is just the flow rate of the CO2 insufflator can be kept very minimal. Okay, normally our flow rate is set to about, depending upon what CO2 insufflator you have, the flow rate can be set at say around 10 liters or say 15 liters. So forget about the flow rate. Okay, if you understand the principles of laparoscopy, flow rate kitna bhi ho, the Veris needle will take less amount of CO2, as simple as that. A 10 mm trocar will take more amount of CO2. So try for tomorrow. अपना खुद का पेट पे लगा के देखेंगे ना, कल सब लोग देखेंगे 26 नंबर का नीडल लेंगे, CO2 को अटैच करके, यू जस्ट इंसर्ट इनटू एब्डोमेन, थोड़ा सा एब्डोमेन को जेली लगा के एंड सी एट व्हाट पॉइंट ऑफ टाइम यू विंस. सिर्फ आंख के नीचे मत लगाना, दैट्स ऑल. Because the needle that Dr. Mishra showed, it is just like any other, I think, scalp or any other needle. 16 or 18 gauge needles. I think 16 gauge needle should be good enough.
She said 30, no?
30 खूप जाड नहीं होना गौरी. 30 is too.
Very
30, 32 सर चलेगा.
32 चलेगा. अभी 32 मिलता है क्या अपना?
बिल्कुल सर, बिल्कुल. इट इज अवेलेबल. और नहीं तो इंसुलिन सिरिंजेस के लिए जो नीडल्स है ना, वो वाली क्या उसको बोलते हैं, बीबी सिरिंजेस, वो चलती है. 26, 28 विल आल्सो डू. ऐसा कुछ नहीं है.
नहीं किरण सर तो बोल रहे हैं उससे नीचे आओ. वेरी थिन. ही इज आस्किंग फॉर थिनर वंस.
नहीं गौरी, 26, 28.
और अच्छा है.
26
और अच्छा है. See, because on face, if somebody is doing, so he or she wants something very fine. But in cases of stretch marks over the tummy or for fat, we can go with a bit thicker needle. How much our patient tolerates. So you are absolutely like, this is very innovative to do something on ourselves first, and then yes.
So we'll have all laparoscopic surgeons with flat tummies in some time.
Naval, are we set?
Sir, am I visible and audible now?
Dr. Amrita, we can see you and hear you here.
Yeah, but then, sir, I'm logging in with my mobile because I don't know why my laptop is not working. I'm just trying to. So, can I just start from here if you can see me and hear me?
Yeah, you are very
we can
much
see and hear you, but I mean, how are you going to share the presentation?
Sir, I'll just see if,
No. Does your laptop have a hotspot? I mean, laptop should have a net connection.
Sir, it has Wi-Fi, but then I don't know why it went off. And now it is connecting to the Wi-Fi, but somehow the video and audio is not playing.
No, so what you can do is you can share the hotspot of your mobile
Yes.
and shut off and you can shut off your video. So the less bandwidth will consume. Unfortunately, we will not be able to see you.
Okay, no, sir, I'll try. But then with the mobile, can you see?
Yeah,
Oh, no.
mobile we can see you and hear you both, no problem. But I mean, how are you going to share the screen? You can share the PPT on the
Can
mobile,
she
no
share
problem.
it with you, Kiran? She can share the PPT to you and you
There's
can.
a copyright issue. No?
Yeah,
Acha,
yeah.
okay.
So I'll just a sec.
I have no problem. She can share it with me in
So
our
you give her an undertaking. I will not share this with anyone.
Okay, I will. I swear by Amox that I will not share anything.
No, so that's totally fine. I'll just try if I can do it with my mobile.
कीजिए बेटा कीजिए, कोई problem.
Just give me a minute or two.
I think Nagpur is having some internet issues. Nagpur is not so safe today. So
Yeah.
I don't.
Yeah, I think you can see. So can you see now?
Yeah,
Yeah,
we can
yes,
see.
ma'am, we can see.
Perfect.
So you
That's
can see
okay.
me,
Yeah,
hear
yeah.
me.
We
Sorry?
can we can see the presentation. We can hear you. You can go ahead with the presentation. No problem.
And can you see me?
Unfortunately, no,
We
ma'am.
can't see.
But the delegates have your picture and your biodata with them.
Oh, okay. Yeah. Okay. I'm so sorry for this inconvenience and technical glitch because not pro with all these gadgets. But yeah. So without any further ado, let me start. First of all, I would like to thank Dr. Kiran sir for giving me this opportunity, and also Dr. Parul ma'am. I'm really grateful to you. Thank you, sir, and thank you, ma'am. So today my topic is genital peels. Before I start my topic, let me ask you, as a gynecologist, how often do we get patients asking for genital area skin lightening? As a woman, how often do we think of getting a genital area skin lightening? Ladies, it's no secret. Women pour a lot of efforts in taking care of themselves. From the nail salon to the hair salon, at spa treatment, at home remedies, we all follow a regular ritual. Self care is a good thing. It promotes it boosts our overall confidence and well-being. So then, why the aesthetic appearance of the genitals be excluded? And who else, as a gynecologist, to guide our women patients? So, presenting to you the genital peels. So, what are exactly genital peels? So, it's a chemical peels. These are used for genital skin brightening, lightening, and evening the skin tone. So, what is the relevance? Chemical peeling is a century old practice. It dates back to the Egyptian era. Famously known Queen Cleopatra, she was known to bathe in sour milk. It improves the look and texture of the skin. Today, we all know that sour milk contains lactic acid, a naturally occurring alpha hydroxy acid. So, what is chemical peeling? It is basically application of a chemical substance to the skin to achieve controlled destruction of the layers of the skin, epidermis or the dermis. And it also stimulates the collagen remodeling and rejuvenation. So, what does a chemical peel do? It stripes away the skin's outer layer in a controlled manner. There's a destruction to the epidermis, and in deeper peels, even the dermis. It stimulates the skin's regenerative process and including the production of collagen and elastin. It also inhibits the activity of tyrosinase. We all know tyrosinase is an enzyme which is used or which acts as a catalyst for conversion of tyrosine to L-DOPA, which is the step in melanogenesis. So it inhibits the tyrosinase activity and hence the hyperpigmentation. So coming to what are the different types of chemical peels. There's a light chemical peel, This works only on the topmost layer of the skin, that is the epidermis. These types of peels exfoliate the skin to reveal the underlying new skin. Then there is the medium chemical peel. Along with the epidermis, medium chemical peels work on the upper and the middle layers of the skin. They remove the epidermis and the layer beneath it. Multiple sessions may be required to get the desired results, and also the healing time is more in medium chemical peels. And lastly, there's the deep chemical peels. These deep chemical peels remove the upper and the middle layers of the skin. These chemicals are very strong, and the subject needs to be put under local anesthesia while the surgery is performed. So, the effects of deep chemical peels may last up to 10 years or maybe less, but in years. However, the healing time of deep chemical peel is much higher and can take up to few months. So, generally, medium or deep chemical peels are not applied in the genital area. So this is, you can see how the superficial, medium, and the deep chemical peels work at which layers. You can see the superficial peels work at the epidermis and just the layer below it, beneath it. Then there's the medium peel, and then the deep peels, which also works at the dermis. So now, what are the causes of hyperpigmentation? So hormonal fluctuations, especially during pregnancy or menopause, friction from tight clothing, genetics, aging, waxing or hair removal creams, recurrent fungal infections, post-inflammatory hypopigmentations, genital warts, melanosis, acanthosis nigrans, that is PCOS, PCOD symptom, systemic diseases like diabetes mellitus, Cushing's disease, and Addison's disease. These are all the causes or may be responsible for hyperpigmentation of the genital area. So then what are the areas we can target with the genital peels? So that's the mons pubis, labia majora, inner aspect of the thigh, buttocks, perianal region, inguinal region, underarms. So the step guides for genital peels. So counseling and history. Counseling is very, very important. In the very first lecture, Dr. Sejal ma'am had very nicely said that mostly it is a doorknob moment in aesthetic gynecology. This itself is like that. This is not a disease per se, but when the patient comes in your OPD for some other problem, and while leaving, she just asks, ma'am, नीचे की एरिया बहुत डार्क है, कुछ लाइट करने के लिए ट्रीटमेंट है क्या? So counseling is very important here because you have to make her sit down, listen to her problems, listen to her concern, and what you can bring to the table. So this is very important. History, obviously, obstetric history. If she is breastfeeding, if she has just recently delivered or pregnant, its obstetric history is important. Then ask for history of any systemic diseases like diabetes, lupus, psoriasis, history of genital warts or herpes infection, recent surgical or cosmetic procedures, and also discuss about the specific concern of the patient, what she exactly wants, what area she wants to be targeted, what is her concern, whether it is just what she wants, the lightening or the smoothing of the skin, or she wants just the wrinkle free or some patches. So this her specific concern, listening to her concern is really important. And then you have to set realistic goals. You have to show her the pictures which have moderate changes. You cannot show her like if she is having an Indian skin type of, like, say on the Fitzpatrick scale, if it is like type 4, you cannot guarantee her the European skin, like say 1 or 2 type. No, it just goes one shade lighter. So you have to show her the moderate changes pictures and make her aware of the realistic images. Then, so coming to the preconditioning of the skin. So before going for a chemical peeling of the genital area, we have to precondition the skin. So preconditioning for a chemical peel involves preparing the skin to maximize the treatment's effectiveness and minimize the potential side effects. So why preconditioning of the skin is important? It is important because it is critical for preventing post-inflammatory hyperpigmentation, ensuring uniform penetration and reducing healing time. It is important for the Fitzpatrick type 4 skin, which is more prone for pigmentation. So now, number of weeks of preconditioning is equal to the skin type number. So this is the Fitzpatrick scale, you can see generally the Indian skin type is type 4, type 3, type 4, or type 5. So depending on the type of the skin, you have to precondition that many equal to number of weeks. So for example, if her skin type is type 4, so you have to precondition her skin genital area for almost 4 weeks before going for a chemical peeling. So now, for what are the what you can use for preconditioning of the skin? It is combination of hydrocortisone 1%, that is very gentle steroid cream, or you can use retinoic acid 0.025%, that can also be used to help the skin become tolerant to the acid penetration, because these chemical peels are basically acid. So penetration, and potentially it reduces the recovery time. Retinoic acid, but should be stopped at least 5 days before the procedure. Other options you have are like azelaic acid. Kojic acid is very easily available and can be used. Lactic acid creams and licorice root extract. These all creams can be used for preconditioning of the skin. So, what instructions you have to give to the patient for preconditioning of the skin? So, pre-peel instruction, that is, you have to apply the cream every alternate day, and then once the skin is accustomed, the patient can apply the cream daily. She also has to maintain a good hydration. Then you have to schedule the appointment when patient is not in her menses, and she has to shave at least 3 days prior to the procedure. Also, here you have to tell patient that if at all she is smoking, she should stop at least 1 month before the procedure. The smoking should be stopped, and after the procedure also for 6 months she should not ideally smoke. So consent, we had a whole session for the consent, but here I would just like to tell that taking an informed consent for the procedure is important. You have to tell the patient what exactly she wants, what exactly you will be delivering, what chemicals you will be using, what peels. So you have to just inform her in her local language. You have to tell what it is. So explain the expected end result. As I told you, you have to give the realistic images. You cannot just say her that yeah, you might go 2-3 shades lighter. No, just a one shade lighter she can have. But moreover, it is not the lightening, but also the brightening and evening the skin tone. That is more important. So take the consent for pre and post procedure pictures. Of course, taking the pre and post, before and after pictures, you need a consent for that. And of course, you should also counsel her for the complications like erythema, edema, dryness, bacterial infection, scarring, reactivation of herpes, and post-inflammatory hyperpigmentation. So now decide on the peel. This is very important because here your main role comes in as a gynecologist or as an aesthetician. Your role comes in here because there are many peels available offline, online, and patients can anytime just buy them. But here your role comes in as to see her texture of the skin, what underlying diseases, if at all she has, what is the reason for her skin type or skin discoloration, and here you can tell her what acidic peel, what chemical should be used ideally. So we have to decide on the peel. How do you decide that? So now there are different types of chemical peels options: alpha hydroxy acid, that is glycolic acid, lactic acid, mandelic acid, citric acid, beta hydroxy acids, trichloroacetic acid, retinols, and phenols. Let's see one by one. I'll just go quickly about that. So glycolic acid peel. So this is the best and the most easiest for all the beginners to use. So this is like glycolic acid peels are the type of superficial peels. The top layers of the damaged skin, it peels off. So unlike medium or deep chemical peels, they will not affect the underlying layers of tissue. Glycolic acid comes in different concentrations ranging from 20 to 70%. So as a beginner, we can just start with the glycolic acid peel, which has got a little less concentration, and then we can see how the patient responds. And then, as per your experience, you can increase the concentration of the peel. So, because minor skin blemishes are located in the top layer of the skin, glycolic peel can give you much smoother skin with a more even tone. So, to determine what percentage of chemical peel is right, consider mainly the skin type, her concerns, what exactly area she wants to target. Some patients say that they want to target the inner thigh, so you can go a little higher because inner thigh area is little bit, the skin is not that sensitive, so you can go a little higher concentration for the inner thighs. But if she wants for mons or the labia majora, a little less concentration of the glycolic acid should be started as of initially. So, considering skin type, concerns, of course, experience level. For example, a mild 30% glycolic acid is a good starting point, as I told, while 20% trichloroacetic provides moderate results and higher percentage are reserved for the deeper peels. So glycolic acid, again, 30-50% is often considered a lunchtime peel for mild exfoliation, fine lines, and mild hyperpigmentation, whereas 70% is reserved for more advanced users and deeper exfoliation, but it requires more downtime. That is, the healing process is little, it takes more time. Then coming to lactic acid peel. Lactic acid is a naturally acidic substance derived from sour milk. It is a type of alpha hydroxy acid that's used in chemical peels to exfoliate the skin. They are suitable for most skin types and have minimal downtime. Lactic acid 10 to 15% good for addressing hyperpigmentation, minor wrinkles, providing a radiant glow, and especially for sensitive skin. Mandelic acid, it is also a gentle alpha hydroxy acid almonds. It has got antibacterial property. So causes less irritation. It is ideal for skin or acne prone skin. And so the commonly used is like 20-50%. Some studies have also investigated that 45% of mandelic acid is almost equal to 30% of salicylic acid peels. So yeah, that's how effective mandelic acid peels can be. And the benefits are mandelic acid peels can help the acne, clogged pores, hyperpigmentation. Also, as I told that, yeah, 45% of mandelic acid is equal to 30% of salicylic acid peels, which is quite good. And mandelic acid peels may also be safer, better tolerated than the salicylic acid peels. So coming to citric acid peels, so these are sometimes or maybe with very cautious used in the genital area because it generally causes, although it addresses hyperpigmentation and improves the skin tone, but it should be really used with caution because due to the sensitivity in that area, also it is little irritating to the skin, and it, of course, then it exfoliates and promotes the cell turnover, that is okay, but little bit it is irritating to the skin. So in sensitive skin like area in the genitals, it's generally not recommended. But you can also go with the combination peels like glycolic acid 20%, citric acid 5%. We have that peels available, combination of the peels, so you can anytime go depending on the patient's requirement and how you see the skin type or what is the need for that skin. Then coming to salicylic acid peels, it is the beta hydroxy acid peels. These have been used on the skin for more than 2,000 years. It comes from the natural source like the willow plugs dead skin cells. Then coming to trichloroacetic acid peels. So when TCA is applied to the skin, it causes the top layers of the skin to dry up and peel off, not instantaneously, but over a period of weeks. So generally, this TCA peels, trichloroacetic acid peels, are used for genital warts, but of course, it also helps in smoother texture and more even skin tone. But TCA is mainly reserved for the genital warts. We have a proper session for genital warts. So I think that day that ma'am will cover the TCA peels, I guess. Yeah, so they, of course, the TCA peels typically use concentrations ranging from 10 to 35%, or maybe higher concentrations, 35% for deeper penetration. But for skin brightening, lightening, they don't use TCA peels. They are reserved for much deeper penetration. So yeah, concentration of the TCA pills again 10 to 15% for the light peels, 20% is a little moderate or medium peels, and then 30-35% goes higher. So coming to tranexamic acid, these can also be used in combination chemical peels to treat hyperpigmentation. Tranexamic acid is an ingredient which helps lightening the skin and reduce the appearance of the dark spots. Then it regulates the formation of pigment in melanocytes, and it interrupts the inflammatory process that can lead to spots, and also reduces excess vascularization in blood vessels, which causes hyperpigmentation. So combination again, tranexamic acid is combined with the glycolic acid. So 5% of tranexamic acid and 30% of glycolic acid peel is quite safe and tolerable with minimal side effects. So studies also indicate that tranexamic acid is well tolerated by most skin types, including the genital area, when used in appropriate concentration. So mild 5% is quite good. And the potential concerns, of course, while rare, but some individual might experience mild irritation, redness, dryness, especially if they have particular sensitive skin. Of course, patch test is very important. So always perform a patch test on a small area, and then you go for the whole area coverage. Other substances formulated for genital peels are kojic acid, vitamin B12, vitamin C acid, vitamin C, glutathione, bisabolol. So these are the other few chemical peels which are available too. So retinol peels, coming to retinol peels, the genital area is very delicate and sensitive. So this is retinoic acid peels are very strong peels. So they cause irritation, inflammation, and even scarring. So they are not recommended for the genital area. Again, phenol peels, these are also not recommended, although there are few clinics where the phenol peels are used, but then there is no standard recommendation treatment for the genital area because it carries significant risk. It's mainly reserved for the deep pills, but yeah, it's not recommended for the genital area. Again, alternative treatments should be considered. If at all there is an option, rather than going for deep or medium chemical peels, with the light chemical peel, you can just choose some alternative treatments like laser therapy, or even addressing the underlying hormonal imbalance or infections. That is more appropriate where the genital area is concerned. Combination peels, as I said, you can just combine 2 or 3 less percentage, or according to that, you can combine all 2 or 3 chemical peels together. So that's combination peel. Yeah, combining different chemical peel agents or procedures can lead to synergistic effect. So that's why combined treatment is more effective. And of course, with the microneedling, laser, LED light therapy, they can enhance the overall result and the healing process. So there's just one example. I said that glycolic acid 30% and salicylic acid 15%. This is a combined chemical peel which can be used. It also improves. See, now here the salicylic acid concentration is less, 15%. So it gives a good synergistic effect and improves skin texture. And the salicylic acid just helps unclog the pores and reduces the breakouts. So now coming to the peel procedure, what all we need? So we need skin cleansing solution such as acetone or 70% alcohol, whatever you have. Then application tools such as cotton tipped swab, gauze or brush, a small bowl for peeling agent. You need to have a neutralizing agent. Generally with the chemical peel pack, you get the neutralizing agent too. Of course, a small electric fan or a forced air cooling unit, if at all you have, that's a really good thing. And gloves and appropriate self-protective equipment. So peel procedure. First, you have to clean the skin with gentle cleanser to degrease the skin. I have a video of this. I'll share it later. So just clean the skin with a gentle cleanser to degrease the skin. Then apply the petroleum jelly to the sensitive areas where the peel can tickle. And then peel application you have to do with a brush, gauze or cotton. I prefer brush. I'll show you the video. I'll show. So you have to start with the labia majora and then move to the medial aspect of the thigh. Stretch the skin to apply evenly. Avoid labia minora and of course anal opening. And you can apply 1 or 3 coats on patient's pain scale. And how you have to see the pain scale, so 0 being no pain and 10 being very painful, you have to assess the comfort of the patient. If the patient's pain score is 7 without fan, but if it is with 2 or 3 with fan or with fanning the area, if she says that the pain is reduced to 2 or 3, then you can apply the next coat or maybe 2 or 3 coats. But if she says with the her pain scale is 7 with the fan, then apply just 1 coat. So now neutralization of peel, of course, you get a neutralizing agent, but then how do you know the end point of the procedure? So patient's pain scale is at 7, you need to stop. You see visible frosting as in like the flakes or the scaling. So, and if the maximum time on the peel kit is reached, so you have to stop there. That is the end point. So neutralize with neutralizing agents, cold distilled water, whatever you have, and apply petroleum jelly or gentle moisturizer to seal the moisture. So coming to the post-peel care, do not wash for 5 to 6 hours. You have to instruct her, do not wash for 5 to 6 hours. After 24 hours, the area can be washed with gentle cleanser. Apply agents with cooling properties like aloe vera gel. Maintenance cream should be applied daily. No swimming or intercourse for 2 days. If she has pruritus, she can just apply cold compression or aloe vera gel. And some amount of flaking is expected. Here you have to tell the patient that she should not have the urge to remove those flakes because that might become painful or may lead to scarring. So just that urge to remove those flakes should be avoided. And maintenance session, so follow-up sessions after 2 weeks for a total of 5 to 6 sessions based on the amount of hyperpigmentation and patient response can be done. So now coming to contraindications of the peels, that's the just hypersensitivity, body dysmorphic syndrome. If she is not satisfied, she'll never be satisfied and she'll just keep troubling you. So yeah, you have to see what exactly her need and what exactly she desires. So active herpes infection, then lupus, psoriasis, uncontrolled DM, recent surgical or non-surgical procedures in the genital area, smoking, poor wound healing, and pregnancy or breastfeeding. So, what are the complications? Just the erythema, contact dermatitis, dryness, edema, the activation of herpes, hyperpigmentations, bacterial infection, keloid formation, hypopigmentation, scarring, and atrophy. Video I'll show later. So, this is the way the flakes appear. Yeah. So once the upper layer peels off, one can see the newer, younger looking, wrinkle free, lighter skin. This was the second sitting for the patient post. So that's happy patient, happy doctor, and happy genitals. I don't know whether that's yes. Yeah. So the benefits of chemicals peels are they can be used alone or in conjunction with other rejuvenating procedures. And chemical peels offer a less expensive, better tolerated modality in patients of all skin types and with less post-treatment morbidity. However, the success with the chemical peeling requires choosing the right peel for the right patient along with the preconditioning to get the skin in the best shape possible. So, chemical peels are not only used for lightening, brightening, but also for improving the skin texture, skin tone, treating wrinkles, acne scars, genital warts, and the other scars. So, with the right selection of the patient, right counseling, right chemical peel, and minimal investment, you can start this procedure right away and call yourself an aesthetician, but with the right attitude. So aestheticians are one who makes skin glow before coffee, banishing wrinkles, worries, a wizard armed with potion spells and lotions. Yeah, thank you.
Thank you, Dr. Amruta. It was really a fantastic presentation. Now you can shut off the screen sharing.
Yeah, so I'm just trying.
I think
Oh, yeah, you have a video.
the
Sorry.
video, yeah, ma'am
Ji,
is
ji,
going to show
you have a
video.
video.
Yeah.
Sorry.
Yeah, I have a video. Let me see how I can show that video again. Okay. Yeah, can you see? Can you see?
Yes.
Yeah. So I'm degreasing the skin first. I'm just cleaning.
So you clean with just plain water or distilled water?
So 70% alcohol, as I said, anything, yeah, it's good. 70% alcohol, what we have,
So it is
the
commercially available.
betadine. Yes, yes. So betadine, Savalon, whatever it is, yeah.
Okay.
So now this is the brush I'm starting, and I'm so this patient was my regular patient, and she was undergoing a PCOD treatment, and just she happened to tell me that she was getting married in the month of June or July, and she told that she's going for a pre-bridal treatment. So I just suggested, why don't you do this? And she was very excited. And she said, "Oh wow, I didn't know that these things also are for the genitals," and she was really willing to do it.
Now this brush is a simple, I think, cabling brush which you use for
Yes, sir.
painting.
Yes, sir. Yeah, yeah. A simple brush, but of course it is clean and sterile. Like
Right.
it's just clean properly. That's all.
And which is the
You can
brand of
also
the
use the cotton, gauze, whatever, sir, you can.
which is the brand of the, yeah, that will come to later. So you are stretching the skin and then applying.
Yes, sir. Yes, sir. Yes, sir.
Now,
I just,
let us, as you are applying, let us go by the questions. Number one is, do we check for allergic reaction elsewhere, like on the forearm or on the arm or on the hand, before you apply the peel?
see, I said as sir, a patch test has to be done,
Okay.
and I rather recommend a patch test, a small patch on the mons, because it's quite easier. Because on hand, of course, the skin is sensitive in the genital area, so I recommend a small patch test on the mons. That is more
Okay.
better option
Okay.
rather
Okay.
than hand.
Okay. Should we
Should
avoid it
we?
during pregnancy and
So
lactation?
this is the flakes we can see.
Yeah.
Yeah, yeah. I'm so sorry I had to do this presentation on mobile.
But you have done a good.
I just managed it somehow, sir. I'm really sorry for that.
No problem. Yeah, so you can stop sharing, Dr. Amrita, so that you know your bandwidth will improve. You can stop sharing. You have shared. Yeah.
Yeah. So the next question is, should we avoid genital peels during pregnancy and lactation?
Yes, of course, because pregnancy causes hormonal changes. So, of course, she might not get the results are desired. So, of course, it is not. It is, and of course, pregnancy itself is like maybe the poor healing or wound healing is not good. So, yeah, pregnancy, no, definitely no. You have to wait even after the delivery. You have to wait for at least 1 year. So, yeah, not even during breastfeeding.
Right.
Yeah.
If a patient has undergone laser hair removal, can she have peeling also? This is my question as well.
Okay. See, generally, genital, I mean, the chemical peel, you can combine or club the treatment together, but not at the same sitting. At least there has to be 1 month gap. Because if you're like first you go for a chemical peeling, and then after 1 month you can go for this laser. But if she has already undergone laser, then 1 month she can wait and then she can go.
All right.
Yeah.
Duration of peel application to get positive results.
So, see, at least in the first sitting, there won't be lightening of the skin. But of course, there is the upper layer of the skin is shed off, and she can see a little toned or smoother or a brighter skin. So it takes at least 2 sessions, maybe more, 2 or 3 sessions. But yeah, you have to tell her, counsel her at least for 5 to 6 sessions. But what I have seen, this was for the second session, and the results were quite good.
So
Right.
5 to 6
And
session, and what is the interval between each session?
two.
So 2 weeks, 2 weeks, 15 days. Yeah.
Okay. I think can we give oral tranexamic acid along with local? along with the peels. So you said we can combine TXA with the peels. So they are asking if we can give oral.
No. Tranexamic acid, not orally. I was talking about the tranexamic acid peels are available. Yeah, I was talking about the acidic, peels. Not oral. There's no oral actually.
Correct. Then what
Yeah.
is the role of IV glutathione?
Of course, it causes skin brightening, lightening, but of course, glutathione peels are also available. If with a lower concentration you want to start, you can start. I'm talking again about the glutathione chemical peels which are locally
Right.
applied. I'm not talking about the IVs.
Okay.
Yeah.
There's one more question. Is it
But do you
painful?
recommend to give IV glutathione along with the peels? Because nowadays it's
See, ma'am,
coming out. It's in vogue. Pre-wedding. So many
yes,
parlors are
yes.
giving IV glutathione. So since you are into this, we would like to hear from you about it.
See, of course, ma'am, what parlor or the what salon people do, I have no idea. We don't do it. We are just doing the chemical. But if at all she has done that, we can just keep a little bit gap. But yeah, we don't do IV glutathione and all. We don't do it. No, it's just glutathione peels that can be done. Yes, definitely that can be done.
Madam, what is the maintenance cream?
So whatever creams, soft creams, whatever patient wants to apply, aloe vera AD cream is there, which has I mean these are very soft and gentle for the genital area. So maintenance cream generally I have seen aloe vera based creams, aloe vera. If I'm just giving the some few brand names like aloe vera AD, Dermadew aloe vera creams, these are all very good and soft. The maintenance cream, that's all.
Okay. Where can we get these peels?
Okay, so there are many companies, the stockist. Generally, what I have used here is Leah Dharma company. Yeah, that's a good. In Nagpur, in my setup, I found this person and the stockist very helpful. So yeah, but you can get. I would not prefer ordering it online or somewhere. But you meet the company person, you see, you can even talk to your dermatologist colleagues what they are using, and then you can, because they have been doing it since quite long. We are like just so yeah. I took a help of my dermatologist friend, and then they suggested me. I just went through the literature, everything, and then I bought it from the company, not from the online
Any
shop.
international brand that you are aware of?
Yes, sir. Derma Milan is there. Derma Milan is there.
Few Indian companies like Akar, Lee Derma, they are also
Really?
having very good
Yes,
peels with
yes,
them.
sir. Ma'am, I
Akar
don't
is
do that.
having, yeah, but Akar is having intimate care peel karke. एक newer they
Okay,
have launched. This is the only Indian peel available in the market for intimate areas. Intimate
okay,
peel, and that is Me
okay,
Line peel. That is globally available with the name of Me Line, and they have come
okay,
up with intimate peel.
okay.
Sorry for
No,
disturbing.
thank you, ma'am. Thank you for that input. Yeah.
Is there any teratogenic effect of pills?
Teratogenic.
Yeah, if she conceives within 1 month or something.
See, generally these we go for a superficial peel, and a superficial peel, as I said, they just penetrate the epidermis. So no, not really. But if she at all conceives, that's okay. She can still continue with the pregnancy, no teratogenic effects, because they are not entering into any dermis also. Yeah.
There's a question. What if accidentally we apply the peel to labia minora?
Okay, so what I generally do to my patients, just the petroleum jelly, I apply it to the labia minora. And if the patient wants for the buttock region also, I apply it to the anal region. So generally, if you apply a petroleum jelly, that just gives a little coverage. So even if little bit acid, it won't irritate. But if at all you haven't applied any petroleum jelly, so just a cooling, you can just wash it off with the cold distilled water. It will just go away. Yeah.
Okay.
But applying a petroleum jelly to labia minora and the anal opening, it quite prevents the irritation
Irritation.
of. Yeah.
Right. Can
A
patients
simple micropore tape also, no?
Yes, sir. But
पेंटिंग करते वक्त जैसे करते हैं ना, to prevent
yes,
pain.
sir. Yes, sir.
Yeah.
Yes, sir.
Can patients wear their undergarments and go home after the peel immediately?
Yeah.
Yeah. They just don't have to wash it. But loose, you just tell them to wear a loose. Of course,
Loose.
not tight. Tight is there. Yeah, loose she can
Right.
wear. Yeah.
I think white is contraindicated in lactation again because of the issues. Yeah.
So hormonal issues.
Yeah.
Yeah, the poor wound healing process. Yeah.
Phone number of stockist. My God. Yeah, हमारे लोग ना एकदम जुगाड़ू है.
Business.
But good one. I mean, yeah, I
Yeah,
agree with Rinda
I'll
से. आप स्टॉकिस्ट का
try.
नाम शेयर करो अमृता जी. So
Yes, sir,
उसका
I'll try.
बिजनेस भी बढ़ेगा और आप उसको बोलो negotiate with him on
He'll
everyone.
be very happy. He'll be very happy.
160 170 ट्यूब्स निकल गए उसके अभी.
So the cost.
Cost of
Cost.
the peel. अमृता जी.
I think disconnect हो गया उनका.
And sir, one peel, how many patients we can do?
While
One.
will
I think it should cover the area. No? Well, yes, Amruta.
Yeah, so 30 ml of vial is there, which costs somewhere around 5,000-6,000. But for this area, what I did, we just barely need 2 or 3 ml. So yeah, 30 ml vial we get for somewhere around 5,000-6,000 per session. You can charge patient according to whatever area you're in. Yeah.
And what's the frequency of application and many maintenance therapies that we have to give them?
So every 15 days.
Ma'am, frequency of application, as in you're asking like the sessions, how
Yes,
frequently
yes,
the sessions? Yeah, so
yes.
2 weeks apart. So like now you have done it, so call her after 2 weeks. Just address her whatever concerns, whatever is she happy, satisfied, not. So after 2 weeks, if she is ready, but of course, yeah, counsel her for at least 5 to 6 sessions for a desired result. So after second or third, maybe session, she can see the lightning definitely.
What is the
This
shelf
was
life of
the
peels?
video I showed was the second sitting for her, and it gave very amazing results.
What is the shelf life of peels?
As in, like
I mean
after.
expiry date. Expiry date. So they must be like 1 year, 2 year at least.
Yes, sir. They are for like 1-2 years.
No, meaning if we have a whatever 30 ml vial and we're using 2 ml today, how long can we use it? Can we continue and wait, or they have to be refrigerated, or how are they going to be kept?
It's like a whiskey bottle. You can use it. Not a
Yes.
wine bottle. You have to consume it in the one sitting.
So
Easy
for wine,
to-
you have Nastic, Kakir, and for the peels, we can't have so
It
many
is easy
options.
to remember that way.
Okay.
So which is the preferable one, the glycolic acid peel or glutathione, or how do you prefer?
Sir, you will answer, please,
No,
or should I?
up. I know.
Okay. So preferable peel, ma'am, it depends on your starting experience and of course what the patient wants. But at the beginner level, it's always better to go for the glycolic acid, lactic acid peels because these are well tolerated and also start with the lower concentration of the peels. So if you are experienced, you have a better verse with all these chemical peels, how they act, so then you can prefer any other peel. But yeah, for the beginner it's always better with the glycolic acid and that to a lower percentage, but
So,
combination also you can use. Yeah,
so kojic acid will be used as a maintenance afterwards with the petroleum jelly.
ma'am, kojic acid cream you're saying?
Yeah, so after like for a maintenance, I mean after the instead of petroleum or any other maintenance cream, you ask them to use kojic.
Ma'am, kojic acid cream is generally for the preconditioning and also the kojic acid peel is available. But after the chemical peeling, I generally don't recommend kojic acid cream. I recommend a very light, mild, just a moisturizer. Like I told, like aloe vera based
Mhm.
creams you have, yeah, they works, because then that also gives the soothing effect to the skin, because if you apply the kojic acid, then it might again irritate the skin.
Okay.
So
Are they
after,
equally
not
effective on
after,
the Are they equally effective on the face?
yeah, so very much, almost they are same.
So सिर्फ cost ज़्यादा रहेगा.
No, it's the same.
Sir,
Cost
Wine
with the
bottle in any glass you take it, it is the same, no, Kiran?
No, but I mean, I don't know. The concentration on the face may be different from the intimate area. Maybe. I don't know. I'm not. Any oral medications to be given, like vitamin E, B12. I think they give a lot of vitamin C.
so vitamin C, vitamin E, these we all, as we all know that, yeah, these improve the skin texture. So of course, hydration, very important, hydration. So these all recommendations, yeah, you can give, no problem. Vitamin C, vitamin E, lots of fluids, healthy diet, yeah, all these things you have to give, and they won't say like have any side effects. Of course, they'll have a good effect.
Does the type of peel to be used depend on the cause of pigmentation, like if it is due to infection or hormonal? So, do you use a particular peel for a particular cause?
Yes, of course, depending on the skin type also. See, most of the time, if she has any fungal infection, if she has itch the skin quite, if she has itching, so now the Junitis skin is of course hyperpigmented, but it is also thickened. Yeah. So now you have to address what exactly her concern is, and depending on that, we have to choose the peel. So now her concern, if the skin is thickened, her concern will be more like, I want a smoother texture, the even skin tone. So that way we have to select the peel. So depending upon her hyperpigmentation concern, or the smoothing concern, or brightening, or evening the skin tone, we have to select the peel.
After how much time can they wash the intimate area?
24 hours, sir.
Okay.
Yeah.
I have a small question. Now, normally, many of the patients do that this Brazilian wax. Okay. So once they do the Brazilian wax, for the primary application after 15 days, probably they can do. But when the next application comes, there is again a small hair growth, obviously. So again, do they have to shave that private parts and then again apply the cream, or it will be applied to the unshaven area?
Sir, it is always better to shave the area 3 days prior to the procedure. Now, within 3 days, even if there is minor hair growth, we won't go for shaving, because then they'll just expose the hair follicles and just might cause an irritation. So that's okay. Yeah. 3 days prior is okay. So whatever waxing she has done, whatever she is, she can just shave it 3 days prior to the procedure.
24 hours she will have to use washroom and wash it earlier. See, obviously, the question pertains to how much time before they wash off the area. So you have told 24 hours, right?
So I can't hear you.
Yeah, so you have told that at least 24 hours need to, after 24 hours, they can wash the intimate area, correct? Now, if the
Yes.
patient has to go to the washroom or has to, obviously, so that area again is going to be soiled with the ablution water. So,
Yeah, so that's okay. If it gets at least 5 to 6 hours, minimum 5 to 6 hours, she can, if she can hold.
okay.
But if at all she has to go to the washroom, and if the area gets soiled, it's okay. But deliberate washing and cleaning, you have to avoid for 24 hours. But minor, of course, that hygiene has to be maintained, of course.
What is to be done if she complains of pain or burning after application?
So cold application, just you can ask her to apply some aloe vera based, or if she is in your clinic, then you can apply the cold distilled water, little bit of icing. You can
Ice
also
packs
give
will be
NSAID.
good.
Yes, sir. Yes, sir. Ice packs, cold distilled water. You can just keep those 10 ml distilled water in your fridge, and then you can just apply for that burning sensation. If she's at home, she can do icing, aloe vera gel. She can apply that, gives a cooling effect. Yeah.
Post-fungal infection, which peel is the best?
Ma'am, can you repeat? I can't hear. Actually, there's some problem with my network.
Post-fungal
Can you repeat the
infection.
question?
Can you hear me now? Yeah. So post-fungal
Yes, yes.
infection, which peel is the best?
Okay, so there's nothing as such like post fungal infection or post some other problems or those. It all depends on the skin type and what she desires. If the skin is thickened, if the skin is hyperpigmented, if the skin is wrinkled, if there are acne scars, depending on whatever she wants, what she desires, what peel you can select. But again, combination, if it is fungal infection, I assume that there will be, of course, hyperpigmentation and thickening of the skin. Maybe there is little bit scarring or whatever. So you can use the combination peels, which works good. So like glycolic acid peel and then lactic. So combination with a mild like minimal percentage of all the peels, it works good. But ask her concern first, what exactly she wants.
Right. Can it be used for excoriation in vulva? Naturally not.
No, no, no.
Any precautions if the patient is taking oral aspirin?
No, ma'am, no, not at all. Not at all.
Nothing like that.
Because this doesn't go beyond epidermis, sorry. Dermis be like it's in deeper peels. Superficial to moderate peels, they just work in the epidermis and a layer beneath it. So no problem.
Okay. Can we have reverse effect like in lichen sclerosis with any peel?
Reverse effects as in
As
like
in,
for
yeah, it got even darker. The skin got even darker.
yes, of course, because these peels, of course, they are used for brightening and lightening, but one of the side effect is definitely hyperpigmentation also. So you have to tell the patients that if at all it doesn't work, it might just darken the skin. Yes.
Okay. And a lot of people are asking for pre and post procedure pictures.
Okay, so actually post procedure, I have shared pre procedure. The patient was very conscious and she was not willing, but I have one more, which of the other patient, not this one. I'll just share it. Actually, I'm operating on my mobile, so I'm finding it very difficult. And if I share my screen, I'm sharing everything. Yeah. So,
Tranexamic acid and glutathione are available separately, and we have to mix them, or are they available as a combination?
taking two other peels and mixing and these things should better be avoided. Rather, whatever we have in a combination, it's much more preferred. Rather than we taking and mixing it, then we don't know how much ml to. So no, it's better you take the pre-mixed or pre-prepared ones.
Any other questions?
How much time peel has to be kept after application?
Yeah. So this again, as I told you, generally it is mentioned on the peel pack, the maximum time. That is that one thing. Then second, if you see flakes coming, peeling off of the skin, and third, the pain tolerance level of the patient. So if she can tolerate to like if her pain is on the scale of 0 to 10, if she says it's 7, so then you should just stop the procedure there itself. You should just do the cold compression so that the effect of the acidic peels drop down or maybe stop. Yeah.
Right.
Generally 7 to 10 minutes.
Okay. I think that's it. Do we have any more questions?
Amruta, one question from my side.
Yes, ma'am.
Yeah, hi. See, there are pre-peel solutions also being available in the market. Along with that, there is like a peel kit which is available in the market. So, what do you recommend? Like, do you recommend like using of pre-peel solutions for every patient, or how do you start with the procedure itself?
So, ma'am, the peel kit we have, yeah, that they provide with the peel and a neutralizing agent. So, pre-peel, that is, as I told you, that is a preconditioning of the skin. If they provide with the kit, that's okay. But then otherwise, if they don't provide preconditioning of the skin, as I told, it's you have to do the preconditioning of the skin. So, depending on the skin type, 3 weeks, 4 weeks prior to the peeling, you have to precondition. That is pre-peeling you're talking, right? If I'm not mistaken. So you
Yes,
can ask
pre-peeling
them
at the
to,
time of
yeah,
procedure.
at the time of
Pre-peeling at the
procedure.
time of procedure when the patient is in the clinic.
Yeah, so if there is available with the if the kit, in the kit, I have generally seen what they provide with the peel and the neutralizing agent.
Can I take this?
They could just
Yeah,
degrease
Yeah,
the
ma'am, please.
yeah. The main purpose for that pre-peel preparations are for degreasing that area.
Yes, yes.
Only for the degreasing. As she told, the preparation that starts at least 2 weeks, 3 weeks prior to the this procedure, and that pre-peel preparations are for the degreasing procedure for that area. So you do that degreasing and then you apply. Some provide, some
Yeah,
don't provide. So that doesn't matter actually. You can clean that
right, right.
area with your alcohol and other things. Okay.
Yes, I
Okay.
mean, many companies, they actually provide some different kinds of things. Like some
Yeah,
might
exactly.
provide the exfoliating foam, or some might even provide the pre-peel solution, or some may not even.
That is
So
only to
whatever,
degrease that. Yeah,
right, right. Basically for the cleansing of the surface so that we can apply the
exactly.
peel. That's it.
Yes.
Yes.
And how frequently do you use the peeling kit that is being available in the market, where they have like multiple steps into it, or not only just the chemical peels? Or I
Uh,
mean, do you recommend that?
how frequently I use?
I
I
mean,
didn't get
do
your.
you recommend using of a pre-peel treatment kit which is available in the market? Like there are many companies who will give a treatment kit instead of just the pre-peel. I mean, instead of just the solutions.
Yes, ma'am, you can use it. As ma'am said that the that whole kit, if it comes with the pre-peel, the peel, and the neutralizing agent. So you can use the pre-peel. It's degrease the skin. Then chemical, you peel, you apply it, and the neutralizing agent, you just neutralize the acidic action. So you can use.
No, no, no.
Huh.
My question is like, because some companies, they usually provide the facial kits, the kits, basically the facial kit or the kits which is for the brightening and glowing, along with the peels. So it's a combination of say 5 and 6 steps together, which is even available even for the intimate areas. Like many companies even provide for the intimate areas, which are a bit costlier onto the higher side. But can, I mean, do you recommend it using it? Because obviously the cost effective and all we have to see for the patient. But do you recommend using of a kit where it contain like multiple 5, 6 steps in that,
Yeah.
along with
So,
the glowing
ma'am,
kit?
as you said, yeah, as you said that it is quite costly. It depends, but I usually prefer only these 3 steps, and they works wonder. So it depends on you if the kit is available, you want to use it or what. But with these 3 steps also, it works wonders. So yeah, it totally
Okay.
depends. Yeah, what you're using.
Yeah. Okay.
But
Okay.
for me,
Thank you.
what
Thank
I
you,
have
Dr. Amrita.
observed with these 3 steps, it's quite good results.
Ma'am,
Thank you,
what
Dr.
is the
Amrita. It was really an
pre-treatment?
amazing presentation.
Ma'am, what
Thank you,
Yeah.
is
ma'am.
the
Super. Super presentation, I should say.
Thank you.
Mhm.
Thank you so much.
Yeah.
Thank you so much.
ma'am, what is the pre-treatment time, that 2-3 weeks before what you start?
Uh, Ma'am, as I said that like preconditioning, you're asking, right?
Yeah.
Yeah, preconditioning, you can use hydrocortisone 1%. That is a mild steroid cream that you can use. Of course, initially you have to ask the patient to use it alternate day. And then once she is accustomed, then she can use it daily for 2 to 3 weeks prior to the procedure. There's also retinoic acid 0.025% cream. But retinoic acid, you have to ask the patient to stop it 5 days before the procedure. And others are kojic acid. Somebody had asked me about this kojic acid cream that's really easily available. That also you can use as a preconditioning cream. Then many other creams are there, but these 3 are good.
Sir, can you share all these things in the notes?
I'm trying to.
Yes.
I know.
I do not remember.
I know. Sagar.
There's a question. Can you suggest a brand for the preconditioning treatment?
Ma'am, kojic creams, yeah, these kojic acid creams are easily available. Their brand names, retinoic acid creams are available. Hydrocortisone 1%, that's available. Brand names, you can go any. Okay.
Triluma is very famous. Triluma, and then
So
after Triluma,
Persol is
there is
also retinoic acid. So Persol cream is
Sorry,
also retinoic acid.
Persol, ma'am, that's a brand name you're talking?
resorcinol. Yes, that is
Yes,
also.
yes, yes. Resorcinol is yes.
Can we use this for underarm pigmentation?
Yes, yes, of course.
Ma'am, any investigation we do before starting the treatment?
Ma'am, history taking is really important. If she is having any diseases, like for example, I said diabetes mellitus or other, but no, not really, because as I said that we for the genitis we just go for the superficial peels and they don't penetrate much, so no, not needed. But of course, if she is diabetic, if she has any history of any systemic illnesses, then you can just ask her for the routine checkup, but not routinely. We don't do it. Not needed.
So do these peels work well for acanthosis as well in the nape, in the area of the neck and underarms?
Yes, ma'am. Yes, yes.
Any other questions from anyone? I think if we have no questions, we can call it a day, or still.
Sir,
बोला ना.
can we use these peels simultaneously for underarms and nape of neck or genitals, or do we have to have a gap in between?
You can use
Sim-
simultaneously everywhere, entire
Simultaneously
body,
also.
chaka.
Yeah, yeah.
Yeah,
Simultaneously
but you'll have
can
to
be.
charge them. You'll have to charge them separately, you know.
Yes, yes.
Yes, ma'am, definitely charging has to be there.
So better to give a gap. So,
There is one more concept of whole body whitening. How much it is feasible with these kind of peels?
As I said in my like first or like third slide, as I said that in the Egyptian era, that Queen Cleopatra was made to bathe in the sour milk, so that might just have that whole body skin texture improved and brightening, but you cannot put a peel on whole body. That's quite
We
difficult.
are getting ideas for our marketing,
No,
strategies,
no. I'm
whole
asking you
body
can use the
whitening and
30 ml
everything.
kit on a single patient as well if you get a good whitening pill.
What I think we should give IV glutathione and vitamin C and other things, and oral tranexamic acid, oral glutathione, and those hyperpigmented areas of axillary area, pubic area, buttocks, and other parts which are hyperpigmented more than the whole body, they should be given the peel treatment. So we can make a package for whole body whitening, right? Tomorrow only I'm going
Yes.
to make a package in my clinic.
Actually, but idea I am not going
ma'am,
with
you can
that
ask them to
because
make
it's
a
a
water
dermat
bath,
thing.
like a
Yes,
water
yes.
bathing. You can ask them to have a water bath for peeling.
Yes,
Sorry,
yes,
ma'am,
yes.
you are stealing
Sure,
all
ma'am.
my thoughts. Even I thought that we have the tub for the water
Yeah,
bathing.
Yeah, we
Is it
have a
glutathione,
tub
all?
for yeah, we have a tub for
glutathione
water
tub.
bathing. So in my
I
water bathing, I can just ask to sit with the peel, right?
Great, great, very nice.
So if
So
people
from
can,
tomorrow, I think I'm going to change the name as Gynae Spa of my clinic. Gynae.
super.
Yes, ma'am.
Ma'am, you have to give us
Ma'am,
all the
we can
credit
even
also.
put into the mud bath.
Of
As in the
Yes, ma'am. There
naturopathic
are
Okay,
treatment,
thank you
they
mud
so
have
baths.
this
much.
There are
mud
mud
bath
Okay, bye
baths.
bye.
treatment, right? We can just put it in the mud bath as well.
So if people can spend money on Fair and Lovely, I think they can easily spend on this Liaderma or whatever it is. 2 लाख तो खर्चा कर सकते हैं मैडम.
sir, आराम से देते हैं और हमें नहीं देते gynecologist को नहीं देते हैं but derma and especially those dentists who are practicing aesthetic medicine they are giving them only.
Plus,
तो अपना
They are
दूसरा
practicing.
ब्रांड से अपना खोलना ना.
the pre-wedding
पैन बदलो.
pre-wedding treatment is a very big hit right now.
Yeah, these
It's
days.
Yes.
very
Yes.
trending. IV glutathione, vitamin C, everyone is giving.
How
So
to give IV
nutraceuticals and
glutathione?
pharmaceuticals.
Yeah.
How to give IV glutathione?
Hello.
Ma'am, should I?
Hello.
Yes, ma'am, please, because I
Yeah,
have
yeah.
really
So
yes.
600 milligram ampules are available in the market. So that is given in 50 ml normal saline bottle. So what we do, we just combine it with the next bottle of, or you can give simultaneously vitamin C and glutathione. I prefer giving in separate bottles. So another bottle of 50 ml normal saline, in that vitamin C ampules. So they are coming in 25 cc, 50 cc vitamin C, 1000 milligram, 1200 milligram, and these are these glutathione. So these days for bridal packages, higher doses of glutathione, their derma light infusions are coming. They are giving 2400. It has been proven that 2400 milligram of glutathione can be infused at a single, in a single application. So that is also not going to cause any harm. But yes, if the patient is ready, 600 milligram with vitamin C, you can go ahead. These days, levocarnitine, acetylcysteine, these nutraceuticals are also being infused in the practices, and for muscle relaxation as well as for increasing the metabolism. So those patients are coming for, they themselves are telling that now they feel very active after this. So nutraceuticals is another part, and
So,
it
ma'am,
is
IV gluta, so 600 milligram, 50 ml over how much time?
15 minutes to 30 minutes.
And repeat every 2 weekly for how long?
15 days. Sometimes girls are coming like 3 months they have got. So weekly treatments are also being given. You have to give 5 to 6 sessions. It can be repeated weekly, minimum weekly intervals have been proposed over there without any side effects.
Okay.
And any contraindication to IV glutathione? Any contraindication or any precaution which we need to take care of?
Liver diseases. Yeah. Only it has been written the liver diseases. Or if the
So,
patient is suffering from some medical problem, like some overt medical problem is there, you should avoid. Otherwise, nothing like that.
so should we go for liver function test in every patient before we go for like their
Ideally, yes.
ideally?
Ideally. Yes. To be on safer side, being a clinician, we are not the beauticians,
Yes,
because
yes.
in the beauty salons also they are providing this glutathione IV
Yes.
infusions. I have heard about that. Even my person from my hospital is going to different salons and putting that IV just for IV cannula. They are putting that IV cannula. They are asking him, and he
Yes.
only tells me that
Yes.
yes, the renowned salons are giving IV glutathione.
I mean, any particular brand which is more effective and safer for IV glutathione?
No, the renowned brands you can use. Derma brands, many brands are available. So
Like, ma'am, which one you have used in your practice?
should I promote that brand here?
No, like if like your experience with it, so it hasn't caused any harm, so that
See,
we
I
can
told
use
you
it.
Lee Derma,
Okay,
Akar, these two
okay,
companies have got everything with them, and they are having very good, and Derma Milan, Cosmilan, many brands are there. And BioLife is one which is having very cheaper brands and very good also. They have got protocols also. So they share their protocols too. They have got
okay,
some medical team with them, and they have made nutraceutical protocols. So I
okay.
would be sharing their numbers.
Yeah, please, ma'am, please do that. Yeah, thank you.
Any other questions? I think course fees have been wasooled in this talk.
Ma'am, drastic change in celebrities like Kajol.
तो
Exactly.
क्या कर रहे हैं काजोल से?
No, no, drastic change. If any patient wants, then glutathione and
Vitamin C.
that's all.
That's You tell Amrita. I think this is the
Sorry, ma'am, I wasn't listening. Sorry, extremely sorry. What was the question?
It was your topic actually, so I thought. Mhm.
Because, ma'am, your inputs are always so like they are just music to ears. So, what was the question? I didn't get.
They were
Yeah.
talking about, like, she was talking about kajol and what kind of treatment. The example of kajol, everybody gives, like the patients also give that example. Kajol ki tarah wala kar dijiye. What she uses and
So, ma'am, there are
Now,
different kind of serums that are available in the market. So, are these serums the same as these peels that are available?
No, ma'am, no. So, see, the serums are different. These are the chemical peels.
Because they have the serums that are available with lot of for skin, for facial skin
Ma'am,
and
vitamin C serums are advertised like so now very commonly these days we see every other woman is using vitamin C serums. They are totally different. They are not the same. Vitamin C serum you can apply it at home also. That's different. The chemical peels are totally different. Vitamin C serum, if for example, I'm saying, but the serums you just apply, but the chemical peels they actually cause the destruction of the superficial layers, and there's new skin appearing. So they are totally different. They are not the same.
okay, thank you.
Yeah.
Okay, I think in the notes, which is the glutathione brand? I mean, I just couldn't take it. It just skipped me. So माझ्या notes मध्ये it was
Leoderma and Akar.
so redermized.
Leaderma, Akar, and BioLife and Dermamilan, these are the companies which provide the glutathione.
Yeah. I think we have covered
These
all the
were for the
questions.
peels, no, ma'am?
Derma, Akar, BioLife, and the last one which you said.
Me line.
Dermamilan.
Dermamilan.
Cosmilan and Dermamilan.
BioLife, sir. BioLife.
Chalo, any other things? Can we use oral glutathione? Okay.
Yes, of course. The ma'am just now told about how IV glutathione is used. Oral glutathiones, it does work, but no idea.
takes very long to act actually, oral glutathione. So this is a market, a very, hyper marketed, and people are spending a lot in taking all those. It is an antioxidant. So
Yes.
this gives results, like a, milder results are there. But yes, it is very expensive and it takes a long time, 6 months or more, to give the apparent results. So the best is IV glutathione.
Hmm.
But many times what happens, the patients, like somebody was asking about other, whatever is available with peels. So it is all marketing, pre-peel, peel, then post-peel, then maintenance creams and other things. So just make your own pharmacy and just put some nutraceuticals as well as this pharmaceuticals, all those things with you, and just provide all those creams which are actually effective, that aloe vera and other moisturizing creams and other things in an appropriate rates, I think, prices. But these companies are taking like 80,000 is the Cosmelon treatment. 80,000. That is having everything, pre-peel, peel, post-peel, and maintenance cream and other things. And I was looking at that, and few, like, persons are there, they are not coming to us, but they are there. They are asking for something just amazing, something very expensive, something which is made for them only. And there, these kinds of treatments are given to those people.
So
So
it's
let's
okay, no,
pray for
ma'am.
such.
It's okay. Some people want to have a labor birthing suite, and somebody wants to have a normal labor room. So it's
Exactly, yes. Mhm. So, how you are going to present yourself and market yourself? how to sell your skill. One should learn and one should practice. Aesthetic medicine is always rewarding, and aesthetic gynecology also. But we are very busy with our, obs and gynae patients, and they are keeping us busy. So we don't have that much of time. What I do in the morning time, 9 to 5, I am busy with my obs gynae hospital. And then 5 to 9 in the evening, I go to my cosmetic gynae clinic and aesthetic medicine clinic. So that is, that is two different setups, but it becomes very hectic. So in our own clinic, we should divide two parts, the floors and.
Yeah. What you said is right. Actually, in Pune, we have a doctor by the name Dr. Koparkar. So Dr. Koparkar is a very senior dermatologist. I think he must be around 65 now today. So he was the first person to start a salon in Pune, and that time people ridiculed him. Okay, so but that was the first time where he started the Papillon Men's Spa. And today it is so popular. It has a big brand. It has a men's spa. Now they are into everything, whatever you have said. So anyway, thinking out of the box is the need of the hour. So any other questions? Thank you, Dr. Poonam, madam, and thank you, Amrita, and
Thank you
thank
so
you for
much,
being
sir.
here. Thank you, madam. Thank you. Really, it was great to have you here, and we really appreciate your gesture for sparing so much time for Amox. And thank you for everything that you have done for us.
Thank you, sir. Thank you so much for this opportunity. Thank you.
Should we call it a day, or is there any other question?
I think there are no more questions.
No more questions.
Yeah.
Okay. Kaushik,
Fine.
any other questions? Anything that you have to say?
There are no questions, but a very nice comment in the chat box. Salons are giving IV glutathione, and we are running everywhere for all licenses and FDA and 5-year renewal.
वो बात अलग है. See, in Pune, I think the rejuvenation medicine is going to take a new lead. Okay, we have Dr. Sunita. Sunita Tandwalkar has started her own Alive clinic. Many of you may be aware. So, yeah, it is it. Chalo, so we'll pack up today and we'll meet tomorrow at 8 o'clock sharp. Thank you, everyone, for a great evening. Thank you so much.
Good night, sir. Thank you, sir.
Thank you, sir.
Bye. Bye. Cheers.
Yes, sir.
I'll
Bye-bye.
end
Good
the
night.
meeting for all.
Thank you, sir.
Thank you, sir.
madam.
Thank you
Thank
so
you, madam.
much. It was great. Thank you.
Thank you.